Hello friends, you just saw the video on all about Vaser, the A to Z of Vaser. This video is going to talk to you about Brazilian buttock lift, and just watch this video. There are a lot of myths about BBL, a lot of myths created by a lot of doctors in the market, and I'm going to break them all for you, and just watch this. My name is Dr. Amit, I'm a plastic surgeon, and we do a large number of BBLs, or also called the Brazilian buttock lift. So let's start. Now, what is BBL? This procedure was first started in Brazil. That's why it's got the name of the country. And buttock lifts because fat is used to recontour the buttock. So for example, if the buttock is here and it is desired that the buttock rises higher, we create a shape of a buttock by injecting fat above the buttock like this. So in a nice shape, we create a rounded appearance above the normal fold. So it appears that the legs have become longer because the buttocks are now starting higher. We also remove a little bit of the portion of the fat in the lower part of the buttock. So effectively, it appears that the buttock has shifted up. We can also enlarge the buttock, or we can even give lateral prominence. So that Latina curve, which is there in Latin women, so that kind of a curve can be created, or the anteroposterior, the projection of the buttock can be increased, and so a lot of buttock changes can be done with this procedure. How is it done? So we do this with the Vaser. We need to collect some fat. We normally take it from the abdomen. Now patients might be only choosing to do the BBL, so in which we take only the fat which we desire, or they may be choosing to do a 4D body contouring, in which we shape up the abdomen and then use that fat for the buttocks. The whole surgery can take about 2 to 2.5 hours. Post-operatively, the patient is advised not to put weight on their butts for at least 1 week. So no driving. You can't sit like the way I am sitting. You need to sit on a special pillow which is kept below the thighs so that buttock is off. Sleeping, there are pillows which need to be kept below the lower back as well as the thighs so that the buttock is off the bed. After a week or so, the fat is more or less settled down and you can get back to your normal activity soon after. There's a lot of swelling initially, and the final shape can take anything from 3 to 4 weeks. Now there are some myths attached with Brazilian buttock lift. 1. Can we inject as much of fat as we want? Previously, 1500 ml to 2000 liters was being injected in each buttock, but there were a lot of complications being noted. Now, there was a death of a patient who went to Egypt. She was from Britain, and following this procedure, she had problems. So the general advisory today is 1. We never inject fat into the buttock. Into the buttock muscle, not allowed. We always now inject fat into the subcutaneous, inside the skin, inside the fat. Reason? There are big arteries which are there in the muscles, and any fat which gets into those arteries and veins can cause havoc. So now the whole concept has shifted on to a subcutaneous distribution of fat. What that also means is that we are not allowed to do massive buttock lifts. We should only be restricting to say 700 or 800 ml, and if the buttock is large, of course we can do a bit more. Does technique matter? Of course it matters. If you use sharp cannulas, it's a problem. So we always, as a habit, last 10 years have only used blunt cannulas. My instruments are all procured from Brazil. I've used the same instruments which I used in Brazil, and very few doctors in this country have those important Brazilian instruments that we are using. We cannot design any instrument. So no one in India has designed any instrument for a BBL, and if any doctor tells you the same, they're just using marketing tactics to get to you. You cannot design a specific instrument. It matters on the technique. So while some doctors may use Vaser, some use conventional, the whole game is about specific techniques, the skills of that doctor. So this is some of the important things that you as a patient must know. BBLs are absolutely safe, very effective in creating that beautiful shape. And if you have ever desired to get that Latina kind of a look, you should be doing BBL. The advantages you have when you do it with me or at Divine is, 1, a huge experience. Over 12 years, we've done over 1000 Vaser surgeries with over 300, I think it's about 350 BBLs by now. Great reviews of patients who really love the shape. If you check out my Instagram, we put some photographs of how beautiful the buttocks look like. Absolutely safe. The techniques of Brazilian buttock lift that we have developed over the years makes it absolutely safe without any doubt whatsoever. Absolutely no infection. Great recovery, and you are generally assured of everything great. So if you're looking for that Brazilian butt, you get in touch with me, and I'm sure we'll be able to help you achieve your dream figure.